Welcome back to AZH Wound Center in Milwaukee, Wisconsin. I'm your humble correspondent, Dr. Jeffrey Niskota. Very interesting patient walked into the clinic today. I want to share with you some clinical findings. This young man sustained a toe fracture about 3 months ago, and then after that fracture developed some drainage, obvious frank ulceration on both the medial as well as the lateral aspect of his toe. And he was sent to the wound center for evaluation of the toe. At AZH, as most of you know, we've been very successful in taking pre-medical school applicants, giving them some clinical experience, and then allowing them to get into school. You've met a couple of our prior MAs. You're going to meet two more today. Our newest MA and hopefully future doctor is Eloise. Eloise is here with us, and she's joined the AZH team this week. You met William before. William just got a nice shaved, sheared haircut there. You're looking pretty sharp, William. Congratulations. So in our ongoing efforts to teach, I want to show you guys this. So a couple things that we notice when we're examining tissues. We will do a good exam of the ulcer. That involves probing. And if you see here, he's got some necrotic tissue that is evident extruding from the wound, and that raises concern for probing. And if I probe, I'm right down to the bone. You can see he's got some purulent drainage coming from the wound, but I can probe the bone. Here on the lateral ulcer, he also has some depth. You can see that Q-tip goes in, and again, if I probe, I can probe the bone. So that's significant, being able to probe the bone from the external. One of the things that I want to do is have you guys appreciate this. If I take and I palpate and move this tissue around, I can actually feel something happening inside the wound itself, and I want to teach you that term. So now that you got gloves on, what I want you to do is grab the toe, proximal of the toe and the distal, and I want you to move the tissue around. Tell me what you feel. Okay, Eloise?
Oh,
What do you notice?
like a crackling? type
Like
of
crackling, like a grinding sensation.
Uh-huh.
What do you think that is?
thing? That the bone?
That's the bone. Okay, that's the bone grating against itself. So we obviously have a fracture here, and I can actually move that
Right.
bone. Whenever you have an open wound that you can probe the bone,
Uh-huh.
or a bone that was fractured and then later blew out with an ulcer, you're worried about an underlying what? Jonathan is also another MA. He's the guy behind the camera. So Jonathan, you can
Osteo infection.
osteomyelitis, right? So this is the clinical definition of an osteomyelitis, the fact that I can probe the bone. The fact that I can have bony crepitance,
Yeah.
okay, is also very, very suggestive of underlying bone infection. And this is what this right here, that grating sensation that you feel when you're moving the bone around, is called crepitance.
Crepitance.
Okay? So that's the term of the day.
Do you need to establish traction?
So no, this is infectious processes and treated by infectious processes. This gentleman is at high risk for a loss of this digit if we can't save it.
Uh-huh.
But part of this evaluation was interrogation of his vascular system. His Doppler pulses are monophasic. He has a history of coronary disease, and he gives a good history of claudication. So this gentleman needs optimization of the blood flow first.
Okay.
And we're going to do that here at AZH in our vascular center very quickly. And the importance of that is that if this were to be amputated in the setting of very poor distal blood flow, he has a chance of not healing that surgical amputation. That could progress to the foot. He could end up losing his leg. That's why these diabetics are so at risk. So I hope you've enjoyed this little educational experience. Appreciate our patients' cooperation in this examination. Your introduction to Eloise and William again. Again, this is a learned environment, and we wish them all the best in their applications to medical school this year. Thanks for joining us on another edition of the Wound Care Window.